Hi, I'm Jack Hartley. I'm the owner of Homestead Senior Care, Valdosta, Thomasville, and Tifton. And today I'd like to talk to you a little bit about a thing called hip fractures. I know this is very common, as we know, if we have aging parents or relatives and loved ones, that people tend to have a broken hip at some point due to whatever reason. So let's talk a bit about what a hip injury is. It's a serious injury, and it can have complications that can be very life-threatening. So the risk of a hip fracture increases as we age. Older people are at a higher risk of hip fractures because bones tend to weaken with age or osteoporosis. Multiple medications, poor vision, and balance problems also may make older people more likely to trip and fall, which is one of the most common ways to suffer a hip fracture. A hip fracture almost always requires surgical repair and replacement followed by physical therapy. Taking steps to maintain bone density and to avoid falls is the way to help prevent a hip fracture. So what are the symptoms of a hip fracture? Inability to move immediately after a fall, severe pain in your hip or your growing, inability to put weight on your leg on the side of your injured hip, stiffness, bruising, and swelling in and around your hip area, a shorter leg on the side of your injured hip, and then turning outward of your leg on the side of your injured hip. What is the most common cause? Hip fracture is most often a result from a fall from a standing height. In people with very weak bones, however, a hip fracture can occur simply by standing or twisting. So sometimes you can have a hip fracture because of a fall, but you also can have it just by standing up, and the bones are weak and it breaks. So many people say, well, I didn't fall, I just it broke. So what are some ways to prevent it? One of the things is get enough calcium in your body and vitamin D. Men and women age 50 and over should consume 1,200 milligrams of calcium a day and 600 international units of vitamin D a day. Exercise to strengthen those bones and balance. Weight-bearing exercise such as walking increases your overall strength and allows for your bones to have more density. Avoid smoking or excessive drinking. Tobacco and alcohol reduce bone density. Assess your homes for hazard. Look around, make sure you don't have trip hazards that you can correct. Check your eyes. Have you had an eye exam lately, just to give a good idea of being able to see, especially in changes in elevation or whatever. Watch your medications. Feeling weak or dizzy on a certain medication, you may need to talk to your doctor and make sure that you find out why you're feeling that way. Stand up slowly. Getting up too quickly can cause your blood pressure to drop and cause you to fall. Use a walking stick or a walker. If you don't feel steady when you walk, ask your doctor or occupational therapist for these items that might help in reducing your fall risk. I hope this has been helpful to you at some point. If not, you can give me a call, 229-563-5123 or jack.hartley@homestead.com. Thanks.